Okay, so let's dive in. When you think about medicine, I mean, the absolute foundation,
The bedrock, yeah.
it has to be anatomy, doesn't it?
Yeah.
Especially, for understanding how we move, how we function, and the limbs, well, they're just so crucial.
Oh, absolutely. Upper and lower limbs, they come up constantly. Surgery, physio, sports med, you name it.
And it's more than just knowing the names of things, right? It's
Yeah.
about how it all works together.
Exactly. The interactions, muscles, bones, nerves, vessels, how they function, and maybe more importantly, what happens when things go wrong. That clinical angle is key.
Right. And we've been looking into a resource that seems, well, tailor-made for getting that deep understanding for the limbs.
The source material on Dr. Atef Ahmed's book, 100 Questions and Answers About Anatomy of Upper and Lower Limb.
That's the one. And the way our source describes it, it's positioned as, well, pretty essential if you really want to master this area.
Not just another textbook, then, more like a specific tool.
Yeah, and the format is interesting straight away. The source says it's literally 100 questions, each with a detailed answer.
Mm-hmm. So less reading cover to cover, more interactive learning.
Exactly. The source presents it as a way to really push for deeper understanding, build that critical thinking, and connect the theory to actual practice.
And who is it aimed at, according to the source?
It seems pretty clear.
Hmm.
Medical students, residents, really any healthcare professionals who need that strong practical grip on limb anatomy.
Makes sense. And does the source give a feel for the scope? What sort of areas does it hit?
It mentions quite a range, actually. Things like the pectoral girdle, shoulder joint,
Mm-hmm.
then all the way down to the plantar arches in the foot.
Okay, some major joints and regions.
Yeah, and even specifics like the intrinsic muscles of the foot, which can be, pretty complex. It sounds like it focuses on the really high-yield, clinically relevant stuff.
And what about the way it's presented? You said it's meant to challenge?
That's what the source emphasizes. It's framed as a tool designed to make you think critically, to actively bridge that gap between just knowing the anatomy and understanding its clinical implications.
Okay.
So our mission here really is to explore how this Q&A format, based on how the source describes it, is presented as such an effective method for, well, mastering limb anatomy and honing that clinical mindset.
That's a good question, because there are tons of anatomy resources out there. What makes this approach, the Q&A, potentially stand out, according to the source?
Well, the description gives some hints. It talks about each question being a stepping stone, something that fosters critical thinking.
So the act of being asked changes things.
Yeah, it seems to force a different kind of mental engagement compared to just reading. You have to actively pull out the information and apply it.
That makes sense. Active recall, it's a known learning booster. Instead of passively reading about, say, shoulder ligaments, a question about a specific injury forces you to think. Okay, which ligaments, where do they attach, how do they function under that specific stress? The source's claim about building comprehension seems tied to that active process.
And the source is clear. The answers aren't just like multiple choice letters. They're described as detailed answers, a treasure trove of insights.
Presented with clarity and precision, I think it said?
Yes. So the value isn't just checking if you were right, but the answers themselves are packed with learning points, context.
And critically, the source highlights they're enriched with relevant clinical correlations.
Okay. That's the bridge.
Exactly. Knowing the anatomy of the carpal tunnel is one thing, but understanding why a specific anatomical variation there leads to nerve compression symptoms. That's the clinical link. It makes the anatomy stick because you see its relevance to patients.
So this combo, targeted questions, detailed answers, clinical links, it sounds like, it directly addresses that challenge of moving from just naming parts to understanding function and dysfunction in practice.
That seems to be the core idea presented. And the source puts a lot of weight on the author, Dr. Atef Ahmed.
Right. Described as a renowned figure, loads of experience, expertise, and a real passion for medical education.
Yeah, and it goes further, calling him a true master of the craft with an engaging narrative style. That's important, isn't it?
Definitely. It suggests the book's power isn't just the format, but the quality of the content, shaped by someone who deeply understands the subject and how to teach it effectively.
So you're learning from someone the source holds up as a top educator.
So you've got this strategic format, 100 questions for active recall, paired with expert answers full of detail and clinical relevance.
All curated by someone described as a master teacher.
It does sound like a focused, potentially very powerful way to tackle something as big as limb anatomy.
And thinking about the audience, for students, it's targeted exam practice. For residents practicing docs, it's a way to keep that knowledge sharp and applied.
The source definitely positions it as that invaluable companion for anyone serious about mastering this field.
It seems like the approach, as described, breaks down this huge subject into these manageable problem-solving units, question by question.
Shifting the learning from just absorbing information to actively engaging with it.
And using the questions themselves as the main way to unlock understanding, it makes learning feel more dynamic, more like how you'd actually approach a clinical problem.
Which really aligns with diagnosis and treatment, right?
Yeah.
That often starts with questions. What's wrong? How is it functioning? What structures are involved?
Exactly. You're basically training your brain to think anatomically within that problem-solving context while you're learning the details.
And by covering those key areas, mentioned pectoral girdle, plantar arches, joints, intrinsic muscles, the source suggests it offers a really practical yet detailed map of the clinically crucial parts of the limbs.
A targeted strike, you could say, on a critical area of knowledge.
Okay, so let's try and summarize the essence here based on the source material. We're talking about a resource built around 100 specific questions and detailed answers.
Meticulously crafted, the source suggests. Designed to really challenge you, push your thinking, and strongly link anatomical knowledge to practical use.
And the answers aren't just facts. They're presented with clarity, precision, and crucially, packed with those clinical correlations that bridge theory and practice.
And underpinning all this, according to the source, is the author, Dr. F. Ahmed, portrayed as this highly experienced expert, passionate educator.
A true master of the craft with an engaging style. That's a strong endorsement in the source material.
Absolutely. So the overall value proposition seems really clear. The source presents this as a vital tool, whether you're cramming for exams, solidifying what you know, or just committed to lifelong learning in healthcare.
It's positioned as a direct route to really mastering limb anatomy.
Which brings us to a final thought, maybe. The source material strongly implies that mastering anatomy leads directly to better patient care, to real expertise. So, if a resource structured around just 100 targeted questions and answers, as described, can potentially unlock the secrets of limb anatomy and significantly boost your ability to diagnose and treat, what does that tell us?
What does it suggest about the power of, well, focus questions? About targeted inquiry and really precise applied knowledge when you're dealing with something as complex as medicine.
It's a compelling idea, isn't it? How the way we learn, the way we question, can directly shape our practical skills and expertise. Something to think about.